Room check.
Okay. Hi, Joe. My name's Carrie Sue. I'm going to be a student nurse today. I'm going to do some hand hygiene and pull this curtain for privacy. Can I get your name and date of birth?
Joe Smith, 9/10/53.
Perfect. That looks great. Do you have any allergies, Joe?
Nope.
Okay. It sounds like we have a physician's order to put an NG in due to a bowel obstruction. Are you okay with that?
Yep.
All right. And I'm going to make sure that your head is high flowers for position and your bed is raised up for good working height. And then the first thing I'm going to do is I'm going to put on some gloves and we're going to check your nose here. All right. Do you have any injury to your nose previously?
Nope.
Okay. Blow. All right. Looks patent. Looks good. I don't see any deformities or anything like that. So we'll use the left nair here.
Okay.
All right. Now we're gonna get everything set up. I got my tape set up down here. Okay. And we're gonna make sure you have all the supplies before we start. Here's your linen saver, your tissue, just in case your eyes water. You're gonna need your cup and your emesis basin. All right, and I'm gonna check your gag reflex. Make sure that's intact. All right, that's intact. And the first thing I'm gonna do here, Joe, is I'm going to measure how far we need to make this. So, from the tip of the nose to the earlobe, down to the xiphoid process. Okay, and that's where I'm gonna put my piece of tape. Thanks, assistant.
Yep.
All right. Make sure you want to hold that spot to note where that's at. And just for make sure that's good. All right, that looks good. Okay, and when I'm doing this, I'm going to make sure that I put on water-soluble lubricant before we start. And if he had a pillow, I would move his pillow and make sure his head is flexed. I'm going to make sure that I've warmed up my NG tube. Okay, and when you start gagging, Joe, then we're gonna lean forward and I'm gonna have you sip some water, okay? Here we go. Hyperflexed. Okay, you're gagging. We lean forward, take some sips, Joe. All right, we took some sips. Go all the way to my tape. Okay. All right, I think that's as far as it'll go, Joe. Make sure that doesn't move. Take my tape. Secure the NG tube. All right, that is secure in your nose. And then when I secure it to your shirt, I'm gonna make sure you have room to turn your head. Looks good. Put the tape on, I put the safety pin on. Okay, now we're gonna make sure you can either verify placement through aspirating gastric contents or x-ray or checking pH or bilirubin. So I'm gonna bend it here just in case. Okay, aspirate. Put that in my basin. Check my pH. That's a 4. That's within range. It's in with 1 to 5.5. And then we're going to hook you up to suction, Joe. So intermediate suction and low. Connect that. Make sure that's on suction. And it's working. So that's great, Joe. Okay, Joe. I'm gonna wash my hands. Now I'm gonna come back. Now you've had it in for like 3 days, Joe. We can take this out. All right, I'm gonna discontinue the suction. All right, I'm gonna make sure I clamp it here, Joe. Undo the suction, out of sign. And I'm gonna pull up 15 of air. Okay, I'm gonna insert that 15 of air. Make sure all this is undone. Okay, and when I pull, Joe, I'm gonna have you take a big deep breath, okay?
Okay.
And hold it. Take a big deep breath, hold it. Slowly take it out. Sorry, Joe, a little uncomfortable. Okay, Joe, it's out. You can breathe. And discard in my glove.
Okay.